Good evening, participants and delegates. Thank you for joining Shield Connect. And today we have a doctor from Mumbai, renowned doctor, Dr. Sachin Ajmera. And today he's going to speak on a topic, role of vaginal microbiome in fertility. So let me share a little detail of our page Shield Connect, and I will give brief introduction of our speaker for the day. So let me share my screen. So this is our page shieldconnect.in, where you can find various sections are available. First section is the blog section, where you can find all the topics related to gynecology. So you can go through it, and all these blogs are written by our speakers and doctors. And then we have a webinar calendar section where you can find all the upcoming webinars. So like if you click on our today's webinar, you will be able to find today's webinar by registering your email ID. And here you can post your queries in this comment section so that we can have a Q&A session with our speaker for the day at the end of the webinar presentation. So please post your queries after the end of the presentation. Then we have past webinars where you can find all the webinars that we have conducted on our page. Then we have various awareness pages like PCOS, menopause, GDM, thyroid. So like right now the GDM awareness day is today. So you can also go through our page, GDM awareness page, where you can find all the videos and blogs related to GDM. Then we have a special day pages also, like a hypertension day, Mother's Day, Women's Day. So if you click on any of the page, you will find all the videos related to that topic or day. And this is our leader section, where you can find a detailed profile of our speakers who are connected with Shield Connect. So you can also go through their profile. So this is our page, and we also have a LinkedIn page, Shield Connect. So you can also go through it. We post daily some new articles and posts on this page. So this is our page, Shield Connect. And now let me give a brief introduction of our speaker, Dr. Sachin Ajmera. Sir is consultant gynecologist in Disha Hospital. Sir has several awards and prizes, including Dr. Pramila Bhatia Young Scientist Award, Best Youth Council Member Award, Best Managing Committee Member Award. Sir has been as a co-editor for many books on gynecology, oncology simplified a practical approach, and sir has published multiple publications in journals and textbooks to his credit. So I welcome you, sir, on our platform, and I will hand over session to you, sir. Thank you so much.
Thank you, Nishan, for those kind words. Just sharing my screen.
Yes, sir.
Okay, so I hope you can see it.
Yes, sir.
So good evening, all the delegates. It's a wonderful evening, and today we are going to discuss about vaginal microbiome and how it affects fertility and how what we can do about it. Now, this is one of a bit of a neglected topic, I would say, in gynecology, and not much of discussions go around this topic. But nevertheless, it is one of our important topics, and I think in our OPD, this would contribute to nearly 5 to 10% of our practice. So vagina, as we all know, it harbors a huge different ecosystem by itself, containing billions of microbes. The data from 110 persons of reproductive age reveal that vagina contains 10 raised to the power of 10 or 11 bacteria. This indigenous environment of microorganisms and their genomes jointly composes the entire habitat, which is called as the vaginal microbiome, which is what we refer to as vaginal microbiome. The vaginal microbiome, it plays an important role not only in maintaining women's overall health, but also in the vaginal innate immunity and inhibition of bacterial, viral, and yeast infection. How it does it, we are going to discuss it in some time. Our body in general contains a lot of microbiomes, of which the urogenital side contributes around 9%. The rest, around 29%, is there in the GIT. The rest would be on our skin and the various surfaces. Vaginal microbiome is dynamic and changes throughout a woman's lifetime, and it is commonly dominated by lactobacillus. Now, what is the homeostasis of the vaginal microbiome? Now, in the ecosystem, in the vaginal ecosystem, there is a symbiotic relationship exists between the microbiota and the human host. Now, how does this relationship exist? The host provides the microbiome with a humid, nutritious, and a warm habitat, whereas the resident microbiota, they produce antimicrobial and anti-inflammatory factors. So both of them, the host as well as the microbes, are benefited. And this also constitutes the first line of defense against the non-indigenous microorganisms. So there is a dynamic equilibrium between the organisms and the host. So as we discussed, as we said before, that the vaginal microbiome keeps on changing over the age. So in childhood, you have a different type of vaginal microbiome. During the reproductive age, it changes, and during the menopause, it is different. How and why is it different? We'll go through that. So the dynamic of vaginal microbiome in response to female sex hormone, the vaginal microbiome is generally measured by what is called as Shannon-Weiner diversity index. Now, this measures the amount of microbes that are there and how much of which microbe is there. So during the initial age, the vaginal epithelium, there are no sex hormones, and hence you have a mixture of various organisms that are present. Now, during the reproductive age group, when there is a production of estrogen and progesterone, it leads to the thickening of epithelium, which causes glycogen deposition in the cells. Now, this glycogen is a sort of, a chemotactic factor for all the microbes, and the microbes would just come where the glycogen is present. The cell from the surface, they flake out, and the cell lysis happens, which causes release of glycogen. Glycogen acts as a nutrient source of vaginal microbes, and which causes the rapid growth of lactobacillus as well as the other microbes. But lactobacillus causes release of hydrogen peroxide, which inhibits the growth of other microbes. And so we have a predominance of lactobacilli that is generally present in women of reproductive age. During menopause, again, the levels of the estrogen goes down, and when this level goes down, you would again have a mixture of microbes that are present. So pre-puberty, you have a thin vaginal epithelium, thin layer of mucus, low estrogen levels causing low glycogen, and you have low lactobacillus and high microbial diversity, and the vaginal pH is generally on the higher side. During premenopausal or the reproductive age group, you have thick vaginal epithelium, thick layer of mucus, high estrogen levels, indirectly leading to high glycogen levels, and you have high lactobacillus, which causes more of lactic acid, and hence the vaginal pH is more of acidic, and you have more lactobacillus and low microbial diversity. Again, in postmenopausal, you have thin layer of mucus, low estrogen, low glycogen, low lactobacillus, and high microbial diversity. And when you have a symptomatic, you have something, some infection that is present, the microbial diversity will change accordingly. During pregnancy, the microbiota in pregnant vagina is less rich and less diverse as compared to the non-pregnant vagina, with a predominance of lactobacillus species. So in pregnancy, overall, there is a change in the microbiota, but in the vagina, you would have more of lactobacillus that would be present. So the ecosystem in the vagina up till now, as we have understood, is there is whenever there is estrogen, the pH of the vagina is acidic, and the vaginal flora that would be present is more or predominantly lactobacillus and acidogenic Corynebacteria bacteria. Now, the composition of the vaginal microbes is generally divided into 5 groups. Of these 5 groups, 4 groups are mostly of lactobacillus. So you have group 1 with Lactobacillus crispatus, group 2 with Lactobacillus gasseri, group 3 with Lactobacillus iners, and group 5 with Lactobacillus genesi. Group 4 is classified as non-lactobacillus, and these are the Gardnerella, Pretovella, Corynebacterium, and Atopobium. So these are the minor one of the groups that is there that can be present in the vaginal flora. Now, as we most commonly we discuss that the vagina is full of microbes, but that is not the case. Even the cervix and the uterus would have certain microorganisms that are present. So as we said, in vagina, we are more of lactobacillus, and depending on the hormonal levels, that will change. In the cervix, the median pH is somewhere around about 7 as compared to 4.7 of the vagina. In the uterus, the pH of 7, and fallopian tubes pH of 7.94. So depending on this, you would have different type of organisms that would be present in the upper reproductive system also. So as we said, different bacteria are usually inhabit the vagina, but lactobacilli produce hydrogen peroxide, which creates an low acidic pH environment, which acts as a natural disinfectant. And there is a delicate balance between the two major microorganisms that are found in the vagina during the reproductive years. These are the Candida albicans and Lactobacillus. So any condition that changes the vaginal acidity or disturbs the normal bacteria in the vagina would predispose to an infection. So there is a delicate balance between the harmful bacteria and the good bacteria. And there are various factors which can trigger this balance out. Now, what are these factors? As we discussed before, age-related hormonal changes would disturb the bacteria. During pregnancy, as we said, the lactobacillus is predominant, and you would have a lower concentration of mycoplasma and ureaplasma. There is also a decrease in the pH and an increase in the vaginal secretions. Now, other factors, whenever you have infections, the pH is disturbed. For aerobic vaginitis, you would have a pH of 6 to 8, and the organisms that you would find is Staphylococcus aureus and Escherichia coli. In bacterial vaginosis, we know the pH is somewhere around 4.5, white gray discharge, inflammatory changes, and the organisms involved would be Gardnerella and Mobiluncus. Other factors, depending on the ethnic group, the changes in the pH, smoking can cause alteration in the estrogen levels, thereby changing the microbiome. Cancer or any other disease can cause a change in the diversity of the microorganisms. So we have the normal vaginal microbiota, you have the lactobacillus, causes release of lactic acid, you have decreased pH, which would not allow the other pathogens to grow. And whenever you have the predominant species of Candida, Gardnerella, or Trichomonas, this all can lead to what we call as vaginal infection. So overgrowth of bacteria, which is normally present in the vagina, is what we call as vaginal infection. Now, when this infection process causes inflammation, is what we call as vaginitis. The types of vaginal infection, we all know, we deal with this day in and day out. Most common is the bacterial vaginosis. Then you have the trichomoniasis and candidiasis. And most often, we know the treatment and the specific treatment that we use to deal with this. Now, these infections, if not treated, can give rise to certain complications. What are the complications that we are talking about? Is pelvic inflammatory disease. We know that whenever there is infection, there is predisposition to HIV infection. They can cause persistent discomfort, and it can also cause infertility. During pregnancy, we know these infections can increase the risk of miscarriage, can cause preterm birth, can cause preterm rupture of membranes, low birth weight, and even after abortion, there is high risk of endometritis when these infections are present. Now, how does it affect fertility? Whenever there's a vaginal infection, there is an increase in the concentration of interleukin-1 beta in the vaginal environment. Now, this triggers the generation of reactive oxygen species. So you have the reactive oxygen species that is present in the vagina, and which would affect the membrane integrity and flexibility. It impairs both the tail motion, and also it would impair the sperm and oocyte fusion. So first and foremost, it would not allow the sperm, it would, once it impairs the tail motion, the motility of the sperm would reduce. And if there is, even if it is motile, then even it can hamper the sperm and oocyte fusion. It also, thereby, it disrupts the fertilization as well as the implantation. So what are the current treatment options for the vaginal infection? We have been using antibiotics, antifungals, and they remain the mainstay of therapy. However, the recurrence rate is high and is often associated with side effects. And many times we get patients who have already on their own, they have taken certain antibiotics and antifungals, and then they come to us. So, whenever the infection is there, you do have the specific treatment of the infection. For example, for antifungals or antibiotics, whatever we use. But in addition to that, there is one more important factor that we need to take into consideration, and that is the use of probiotics. Now, there's a lot of confusion between of the probiotics, whether they are really useful, not useful, and how do they work. And that is what we are going to clarify today. So how would you, now we said that basically the vaginal microbiome has got disturbed whenever there's an infection. So how can we restore this vaginal microbiome? And how can we get back the lactobacillus that have been disrupted by the other microbes? How do we get them back? So you have oral probiotics. These are food grade supplements in form of capsules. They contain live organisms and mostly comprise of lactobacillus. Then you have the vaginal probiotics, live microorganisms in the form of capsule, creams, gels, suppository, and again, they are comprised of lactobacillus. And then you have cervical microbiome transplants, not being used as of now because there are certain, the donors need to be screened really well, and there is a risk of transmission of some infection from one to another. But how is it used? It's cervicovaginal secretions are transferred from one healthy woman to another, and microbes are characterized by DNA sequencing. So, but what are these probiotics? Now, probiotics are defined as live microorganisms, which when administered in adequate amount, confirm a health benefit to the host. The main type of microbes that are used are lactobacilli and bifidobacteria. And these are commonly found in fermented foods, and live cultures are usually added. Yogurt, dietary supplements, these all contain this probiotics. Probiotics containing lactobacillus have been used over a long period, can be used over a long period. They are an alternative to antibiotics, and particularly within the context of high infection recurrence rate. Possibility of harnessing specific bacterial strains in order to prime the vaginal microbiota in the pre and periconceptual periods. That is where these can be used. The mechanism of action is, it competes with the intestinal mucosa cell, and you have the anti-apoptotic function, the induction of mucins by which this would act. Now, how does an oral, agent or an oral probiotic reach the vagina? So it's a hard way to reach the vagina. First is through the mouth, you have the oral administration. It passes into the stomach. The probiotic must resist gastric juices and enzymes. And wherein comes, why should we select a good probiotic and how we should select a good probiotic? For this, we should understand how does it reach the vagina. From here, it goes into the gut, into the digestive tract. And here, the probiotics, it must resist the bile juice. Otherwise, if it doesn't resist the bile juice would destroy all the bacteria. And then it colonizes the rectum. There's a rectum colonization. And from the rectum, it colonizes at the vulva. The probiotics colonize the perineum to reach the vulva, from where they'll continue to grow up, and then they colonize the vagina. So this is how an oral probiotic would reach to the vagina. Now, probiotics can generally safe, but it should be monitored. When we say that these are the live bacteria that we are using, so it should be used in caution when patients who are immunocompromised or premature infants or patients suffering from short bowel syndrome, those with central venous catheters, elderly, and patients with cardiac valve disease. In these patients, they should be used with due caution. Now, again, there's a confusion between probiotic and prebiotics. Now, what are the difference between the prebiotics and the probiotics? Prebiotics are compounds that are compounds in food that induce the growth or activity of beneficial microorganisms. Okay, so this is in your gut, in the intestine. So you have the probiotics; these are the bacteria that are there. But in the gut, the organisms will need to survive. They will need food to survive. Now that food is what we call as prebiotics. So probiotics are alive. They are usually bacteria or yeast. They aid in digestion and other health benefits. Prebiotics are a form of fiber that serve as a food for probiotics. And hence a combination of both the pre and probiotics would be what would be an ideal condition. And that is what we call as symbiotics. Now, whenever we are studying anything, these are the 6 questions that we should be asking: who, what, where, when, why, and how to understand the topic in detail. And that is what we are going to do about the probiotics. So why should we use probiotics? So now we all know we have been using antibiotics, but there are newer problems that are created by antibiotics. And antibiotics do not identify between the normal good flora and the bad flora. They would disrupt both the types of floras. Antibiotic resistance, we know, is rising nowadays due to its abuse and over-the-counter use of antibiotics. We are running out of antibiotics, frankly, now. Most of the times we have been using higher antibiotics. Also, there is an interest in the usage of ecological methods instead, rather than using drastic methods. So we all know that antibiotics damage the commensal microflora, can increase the occurrence of resistant bacteria, and can have adverse side effects, whereas probiotics can be used in adjunction to antibiotics to restore the commensal microflora. Now, what to use? The rationale of probiotic using Lactobacilli. We know that Lactobacilli is one of the commonest organisms that is found in the vagina. So it can be used in sexually transmitted disease, to prevent preterm labor, to increase the quality of life, can be inserted directly into the vagina, or an oral preparation can be used. In whom should we use? In women who are prone to urogenital infections or during an infection. In healthy women as a prophylaxis to maintain the normal flora. Lactobacilli probiotics can be used over a long period without any adverse effect, unlike antibiotics. So whenever we are treating a patient with for example, candidiasis, obviously you're going to treat them with antifungal. But in addition to antifungal, if we use a probiotic, the recovery is going to be much faster and recovery is going to be prolonged, because you have been using a commensal bacteria that is there. Now, which to use and which strains should we use? We have discussed that there are various lactobacillus. So basically, products with strains of Western origin may not have the same benefit to our patients. So the native strains will have a better efficacy on the local population. And the product should have the advantage that all the strains are of native origin, with clinical study and safety established in Indian population. So the ideal treatment would be to provide an Indian genome-specific strain, a vaginal-specific strain, and maximum colony forming units of around 10 billion CFU would be the probiotic of choice for treating these patients. Now, is there any proof? I mean, can I prove it that that this vaginal microbiome really helps, really exists? So there have been various studies that have shown the efficacy of this. So there's been studies that have been conducted in the entire world, and we are going to have a look at all these studies. So this is a study that was published in the Indian journal, Biological Control of Vaginosis to Improve Reproductive Health. It said that human vaginal microbiota plays an important role in maintenance of women's health as well as their partners and newborns. Predominantly, lactobacillus community is disrupted, decreased in abundance, and replaced by different anaerobes or bacterial vaginosis may occur. In bacterial vaginosis, overgrowth of anaerobes produces noxious substance like polyamides and other compounds that trigger the release of pro-inflammatory cytokines, interleukin 1 beta and interleukin 8. Bacterial vaginosis can profoundly affect, with different mechanisms, all phases of women's life in relation to reproduction, before pregnancy, during fertilization, and through and at the end of pregnancy, and can affect fertility also. And ascending dissemination of the involved species may lead to tubal factor infertility. So it concluded that exogenous strains of lactobacilli have been suggested as a means of re-establishing a normal, healthy vaginal flora. Carefully selected probiotic strains can eliminate bacterial vaginosis and also exert an antiviral effect, thereby reducing viral load and preventing fetal and neonatal infection. The administration of beneficial microorganisms, probiotics, can aid recovery from infection and restore and maintain the natural vaginal microbiome. Now, this is a study that was published in Human Reproduction in the year 2016, and the implication of their finding was abnormal vaginal microbiota may negatively affect the clinical pregnancy rate in IVF patients. Going on to the next study, this was published in 2019, effect of vaginal microbiome on the pregnancy rate in women receiving assisted reproductive treatment. 31 patients undergoing assisted reproductive treatment with own or donated gametes with cryotransfer of a single euploid blastocyst were recruited for this cohort study. It concluded that vaginal microbiome can influence the results of ART. The profiles dominated by lactobacillus were associated with the achievement of pregnancy, and there was a relationship between the stability of the vaginal microbiome and the achievement of pregnancy. Another study published in March 2020, it said that vaginal composition prior to the start of hormonal treatment for ART seems to be predictive of IVF or ICSI outcome with mainly a highly negative predictive value. Local microbiota, especially the absence of presence of specific microbes within parts of female reproductive tract, seem to be associated with the outcome of ART. Again, this study published in the European Journal of Obstetrics and Gynecology, it said that treatment of bacterial vaginosis would nearly double the pregnancy rate. So 49% vis-a-vis in untreated patient, 24%. And herein we get the evidence that there is definitely a role that the treatment of vaginal infection would have on our ART patients. This is another study that was published in American Journal of Obstetrics and Gynecology, and evidence that endometrial microbiota has an effect on implantation success or failure. The result of the study was the presence of a non-lactobacillus dominated microbiota in a receptive endometrium was associated with significant decrease in implantation and pregnancy rate and the live birth rate. You can see pregnancy rate of 70.6% versus 33.3%. So they concluded that our results demonstrate the existence of endometrial microbiota that is highly stable during the acquisition of endometrial receptivity. However, pathological modification of its profile is associated with poor reproductive outcomes for IVF in vitro fertilization patient. This finding adds a novel microbiological dimension to the reproductive process. This is a study published in China. It said that human vaginal microbiota play a vital role in maintaining the health of women, and the study shows that dysregulation of vaginal microbiota was connected with poor pregnancy rate, spontaneous abortion, miscarriage, and spontaneous preterm birth in human reproduction. Our group found that the age, endometrial thickness, reduction of lactobacillus, and the overgrowth of Gardnerella, Etopium, and Prevotella possess strong connection with the success of IVF, and the bacterial intervention via restoring vaginal microbial diversity to health status may be a good choice to enhance positive reproductive outcomes of IVF. This is a study from the Middle East, and again, it concluded that alteration of reproductive tract microbiota or the presence of certain microbiota, irrespective of the level of pathogenicity, may interfere with fertilization, implantation, and subsequent embryo development. This may lead to failed fertility treatments and reduced live birth rates. So all these studies show the importance of the vaginal microbiome or the role that vaginal microbiome plays in fertility. So to conclude, some important key points that we would like to stress upon is vaginal microbiome changes during normal menstrual cycles with differing estrogen levels in the physiological range. It has been indicated that fertility problems may be due to pathogenic changes in the microbiome of the female reproductive tract from the vagina to the upper genital tract. Abnormal vaginal microbiota may negatively affect the clinical pregnancy rate in both natural as well as IVF patients. There are a large number of unexplained IVF failures, which are part of which can be attributed to alterations in the vaginal microbiome and its impact on the female infertility. Similarly, the presence in the cervical flora of gram-negative bacteria, chlamydia, and Gardnerella, and the eventual coexistent lack of lactobacillus is also linked with infertility. The lack of lactobacillus-dominated flora in the endometrium seems linked to recurrent implantation failures. So probiotics aren't just for the gut health, they can improve fertility and help prevent infections too. Probiotics can help reduce inflammation, which indirectly would improve the fertility. Not only for the women, but also for the man, probiotics improve sperm health and increase the chance of pregnancy. Hence, the role of probiotics in fertility is well proven. Thank you all for a patient hearing. And in case if there are any questions, you can just let me know.
Thank you so much, sir, for giving all this detailed information of vaginal microbiome importance in fertility and how probiotics is helpful. So let me check if we have any questions. So, sir, first question is, does probiotics are needed in all the patients prior to IVF treatment?
See, IVF is a highly specialized treatment, lot of things that go into it. And hence, now various studies, right, since 2014 to the studies till 2020, what we have seen, all the studies have stressed upon having of the normal vaginal microbiome, which might be disturbed. So it is, I mean, for all the patients prior to going IVF, we should have a look at their vagina, rule out if there are any infections. And even if there are no infection, prophylactically giving a probiotic would definitely have a role in all these patients. So even, pre-pickup or, the pre-treatment part, or, when the treatment is delayed for a certain period of time, repeating the dose of probiotic would definitely have a role in such patients.
Then the second question is, which route of taking probiotic will give better result? Is it oral or a vaginal route?
See, obviously, when we talk about it, the vaginal route looks to be more effective, because the inoculation. I mean, whenever we are having this, we are saying that it's an inoculation of the microbes. So the amount of inoculation that would happen is it would happen directly. And as we said, through the oral route, it's a long process for it to reach to the vagina, from the gut to the rectum, from the rectum to the perineum, and from perineum to the vulva, and vulva to the vagina. So obviously a vaginal route would be preferable. But if the patient is not comfortable, then even oral route would give you good results also. I'm better than nothing at all.
And what will be the treatment duration of using these probiotics?
So probiotics, we know that a large inoculum is required of the probiotics to actually colonize the vagina. So a treatment of at least 15 days is what is recommended, and sometimes even further in cases where there have been recurrent infections and things like that, or not responding to treatment. So those cases would be for a longer period of time. But as a prophylaxis, I would suggest at least for 15 days, the treatment should be continued.
And one more question is, does probiotic also help in maintaining endometrial microbiota?
Yes, we already discussed this. As we said that endometrium, the lactobacillus in the endometrium is what is essential for the endometrial receptivity and the implantation of the embryo. So the probiotic containing lactobacillus would, from the vagina, they are going to go to the endometrium, and they are going to alter the endometrial microbiome also. So it would, even for the endometrium, it would be a probiotic containing lactobacillus would be what is required.
Let me check if we have any more queries. So there are no more queries, sir. Thank you for giving all the answers to these questions, sir.
Sure. Thank you so much, Nishan.
Thank you, sir. And we would like to have more sessions with you in upcoming times, sir.
Sure, definitely.
Thank you, sir.
Okay, bye-bye.
Thank you, sir.
Okay, bye.